engaging. We're going to now have someone, I don't see him, and I'm panning again. I don't see Drew. So
Drew is on.
I'm right here.
There you are, Drew. Drew is so special to me. The fact that I worked in nonprofit for about 11 years, and I knew this particular ministry, and that's what it is, prior to Drew. But I was so impressed with him.
Just what you needed. I don't know how you use it, but
he come up with great ideas.
Well, I mean, it was a big
to run
push.
a nonprofit, but he's done a beautiful job, and his love for the population that he served is noteworthy. So without saying any more, because you can see how I feel about Drew. Drew, could you please come forward? And you have, I think, 5 to 7 minutes to talk about Open Table Ministry, okay? As executive director. Thank you, Drew.
Great. Thank you so much for that introduction, Rosa. It's so good to be here this afternoon. I appreciate you all having me. Thank you, Rosa and Becky, for the invitation. And I see a lot of familiar faces on this call. So it is, great to have the opportunity to share with you. As Rosa said, my name is Drew Wotan, and I am the new executive director at Open Table Ministry. Would love to just share broadly about what we do. And I'm going to leave my email address and our website in the chat after I finish talking. So feel free to reach out to me with any questions. We have been a nonprofit since 2009. We started as doing food ministry on 15501 out towards Chapel Hill, but we were incorporated in 2009 as Open Table Ministry. We're a nonprofit that rents space out of Trinity United Methodist Church. We rent out the basement space, which is where I am today. We're right across the street from City Hall. And our goal is to overcome homelessness through the power of relationships, through the power of community, focusing on providing tangible resources to folks, but also meeting them where they are, learning their stories, and building that trust and rapport that really allows us to move people from the situation that they're in into healing and wholeness. We really identify our mission as filling in the gaps when there's not places that people would fit kind of neatly and cleanly into the social services world in Durham. We try to fill in those gaps and come alongside folks. Like I said, we've been incorporated since 2009, but we've been at Trinity for about 8 years now. And where we've really taken a foothold, or we really found like kind of the heartbeat and rhythm of our life together, has been our weekly free store, which takes place every Tuesday. So our free store event takes place in the Trinity parking lot from 9 to 11 each Tuesday morning. You can kind of set your clocks by us being out there on Tuesday. And we have mobile showers, we have clothing, we do personal items, in addition to some other resources as well. So it's kind of holy chaos is how I describe it. You never know what will happen on a given Tuesday, but there's always volunteers that are needed, always looking for groups or donations to get plugged in. So that's always a way to connect with our community. On Wednesday, we do what we call office hours, which is at the same time from 9 to 11. So really try to troubleshoot and direct and connect people with mainstream resources. We do a lot of ID support, especially on Wednesdays. We have our Ready ID program where we help folks who are living unsheltered get connected with their state ID or with their birth certificates or with their social security card. We know how difficult it can be for folks who are unsheltered to track down the documentation, and folks can also receive mail at Trinity, and we can get folks connected with their mails.
That's
Yeah.
good. That's good.
We will be getting back to our Monday meals in the new year, so be sure to look out. If you check our website, you'll see ways to get plugged in with our meals, which will be starting back out on 15501.
That I also want to do. Like, I like that they could.
And then the main thing I was going to share too, just coming up, is we will be providing some white flag shelter on nights when it gets below 32 degrees. So we will not be taking referrals directly for those, but folks can call Entry Point. Again, I'm happy to leave that a link to that number in the chat, but we'll be working with folks who are medically vulnerable or fragile to get folks off the street during cold weather months. between now and the end of March. So I realize that's a very broad overview, and I apologize. I'm sitting right in the light, so it's very washed out, but hopefully you all can hear me okay.
Yeah, I was wondering what happened.
It's a halo or something. No, I'm just kidding. It's
That
something.
looks
I'm
good,
sitting
looks
right by a
homely.
window, and it gets worse if I move my camera. I apologize. So
That's okay.
that's very broadly kind of the scope of work that we do at Open Table. Would love to get connected, whether it's through your workplace or through your place of worship, or if you just
Right.
know family or friends that want to drop off donations or volunteer to get
Right.
connected. So I'm happy to leave my contact information in the chat or answer any brief questions. I know this is just a spotlight moment as well.
Rosa, we also didn't I can't think of the word now. Drew was one of the Duke
Yes.
Chapel's Humanitarian Awards recipients, as I am a former one too. So I just wanted to make sure everyone.
That's true. I'm glad you said it because I pushed that real hard. But Drew was a great cheerleader for him, and any other things that I think Drew could fit into his skills, his passion. I'll be out there beating the drum for him. Like I said, I'm very impressed with this young man, and he has my full support. I've been out in the community for a minute now, Drew. So I hope you and I can continue to move forward and do some things. Are there any other questions for Drew as we move through the rest of the agenda?
I have a quick question. This is Rita McDaniel.
Hey, Rita. How are
Hello,
you?
Miss Rosa.
Did you go off, Rita? There you go.
Okay.
There you
The
go.
reason I'm asking this is because I started recently picking up this homeless man, taking him to where he stays at, but this was around election time. So do you all help assist homeless people with registering to vote? Because he had said that he was going to register, but he didn't know what the process was. But it just so happens that it was the Sunday after the last day of early voting. So is that something you all can help them do for like people that stay at the shelters and where you all put people at?
So I can answer that in a bit of a roundabout way. The short answer is that we do help people register to vote. We primarily use that as a way to show proof of residency when we're working with someone to get their ID. I know there's organizations that help folks get to the polls. I was talking with someone this weekend who was volunteering with them. And when we register, or when you are requesting a duplicate ID, you can update your voter registration status. So kind of short answer is that yes, we do help with folks, but it's always kind of a roundabout way when we're working to get an ID with someone. If you wanted to ping me, Rita, offline, I'd be happy to see what the organization is that helps people vote. And I would imagine that they help more directly with registration as well for that direct purpose. Usually when we're doing it, we're trying to help someone get an ID, and it's less like, hey, we want to help people register to vote, is less of our focus, if that makes sense. Oh, there you go. Someone put it in the chat. Perfect. Thank you.
Okay, guys. Drew, we thank you. You're welcome to hang in with us. We hope you will come back again, and especially with the last thing you had a fundraising. I tried to share as much as I could. I hope it was, and I wanted to say that I'm also on the board of directors with Drew, and that's why this is my passion. I may show some favoritism for that reason, but it is genuine. So do you have the fundraising every year around this time?
Yep. So yeah. Thanks for the plug, Rosa. And I'll let you know our walk was very successful, but circle your calendar for the first Saturday in November next year. It's our annual fundraiser. It's called Walk in Their Shoes. I'm imagining it's going to be at Southern Boundaries Park again, but yeah, it's our primary fundraiser. It's our biggest fundraiser of the year, but it's also just a great chance to come together as a community. Hey, Lloyd. Lloyd was there a couple Saturdays ago. So yeah, appreciate you pointing that out, Rosa. Yeah, and appreciate all your support.
Yeah. Always. Thank you again. We look to hear from Drew again, and he'll visit with us. You guys, I ask you to continue to support the many activities that are going on. This is awesome. Now we're going to move into Rita. You're going to give us a beautiful discussion about the homeless system. Where have we been and where are we going? Okay, after post-COVID. Thank you.
Yeah, it's Donna.
Donna, Rita was in my heart. Donna.
See?
I'm sorry, Donna.
I just wanted to be able to introduce Colin Davis, who is here from our Community Development Department. Community Development is our lead agency for our homeless services. And Colin is going to talk about money spent through COVID and since then around homeless services. Take it away, Colin. I am your moderator, so afterwards I'll moderate discussion and questions.
Got it. Thank you very much, Donna. Let me see if I can share my screen, because if I can't share it, it's going to be really hard to follow all the numbers, unless you got people who are really good numbers people.
That ain't us.
It's not me either. I'm a social worker. I chose social work for a reason. I can do numbers, but not my strong suit. Hang on a second. All righty. So let's start off for just sort of orienting the group in terms of the city and the community development department. And the community development department wears a couple of hats. So it's important for us to remember that in these different hats, we control different funding streams in different ways and have only so much capacity to do certain things because of federal rules, state rules, and local rules. So the first hat that we wear is we are a recipient of our entitlement funds from HUD. So HUD allocates to us, because we're entitlement area, Community Development Block Grant, Emergency Solutions Grant, as well as HOPWA, HOME, and a few others that don't apply to the homeless system. These are the ones that we specifically accept and apply to the homeless system. The second hat that we wear is, as the Community Development Department, we are the lead agency or the collaborative applicant for the Durham Continuum of Care. That means it's our job to kind of ensure that we have a collaborative application that is submitted to the state and to HUD for the Continuum of Care application that comes out of HUD and the state ESG application. And the easiest way, the best analogy I can use for the collaborative applicant is kind of, we're the coach and we got to get a whole team together, and we put together a team resume and a team application, but then each member of the team has their own set of statistics and their own strengths that they bring. So each member of the team, in this case, the members of the team are the nonprofits who are part of that collaborative application. Their application is part of these collaborative applications. So you got a team application and an individual application, and they all go to HUD and they all go to the state. Once the city hands that off to HUD and the state cut the city out of everything, and they enter into contracts directly with the nonprofit entities. So there isn't a whole lot that we control other than making sure that as a collaborative group, the Continuum of Care votes and agrees that these are the organizations that should be funded by these. The third hat that we wear is we administer the dedicated housing funds, which are local dollars that come out of city taxes and are there to be used in the homeless system. Questions on any of this so far? Okay. So let's talk about ESG and CDBG funds. So our emergency solution grant is about $175,000. And that's our entitlement money. And that money goes up and down annually. I think this is the 2021 amount. The 2022 amount is expected to go up a little bit, a couple $1,000s, but it doesn't jump hundreds of thousands of dollars. It typically goes up or down a couple hundred or maybe $2,000 or $3,000. Not a big chunk. We did also receive one-time funding in the amount of $2,662,668 of ESG COVID funds. And we spent these on rapid rehousing, prevention, emergency shelter, and administration costs for all of these. So the admin cost was not all of that was taken by the city. The nonprofits had some of this admin to help cover the reporting requirements, the funding, cover overhead expenses tied to these projects. And our CDBG allocation there's a lot of eligible uses for CDBG. There is a cap on how much can be used in public services. So currently we are using $177,000 for case management of CDBG funds out of our entitlement. Now we get to our HUD COC funding, and we have about $1.9 million approximately that comes in annually, and we split it between rapid rehousing and permanent supportive housing. Permanent supportive housing, for those who don't know, is targeted specifically for people who meet HUD's definition of chronic homelessness. They must, the person in the household must have a disabling condition and have 12 months of homelessness, or 12 months of homelessness with at least 3 breaks in the homelessness over a 3-year period of time. 4 breaks of homelessness in that 3-year period of time in order to qualify for permanent supportive housing. Rapid rehousing is only to be used for people who are literally homeless, unsheltered, or an emergency shelter. And that can be used to pay for security deposits, first month's rent, as well as supportive services. We also use a little bit of HUD's money to pay for a HUD mandated program, the Homeless Management Information System, which is our system of record for the entire homeless system, where client notes and data is tracked to avoid duplication. HUD COC funding priority is given to renewal projects, because if you're in a permanent supportive housing project, your funding can't be jeopardized from year to year, because if that funding is jeopardized, you may have somebody who's relying on those services who all of a sudden loses that support and would return to homelessness. So HUD makes priority is given to renewals. However, there are times where funds are reallocated. And in the competition that we just submitted to HUD, we are reallocating some money from the Durham Housing Authority as well as the Durham Crisis Response Center, which are being reallocated to other projects. Now we're going to look at the state ESG. The state ESG, this is once again, the city serves as the collaborative applicant and submits the proposal to the state for funding, and then the state enters into contracts directly with people. So the 2021 amount that we put in emergency shelter, street outreach, and rapid rehousing are on your left. And the 2022 amount, as you can see, that dollar amount goes up, $1,500. It's $1,400. It's not a huge amount of money that it increased. You will notice that there was a shift in street outreach, and the state requires a minimum of 40% of your funds must be spent on a rapid rehousing or permanent housing option. So this is 40% of our award was spent specifically on the allocation that the state told us we must meet. And that's a statutory requirement by HUD. So we can't change that. We could, if we wanted to, move all of the money out of emergency shelter, street outreach, and put it all in rapid rehousing. If you wanted to, that would not be a problem. But as a community, we've decided that emergency shelter, street outreach are as important as permanent housing stabilization. So that's why you see these splits. And as our numbers of people experiencing unsheltered homelessness are increasing, you'll see the budget for street outreach has increased in our hopes of getting people off the streets and into permanent housing, and hopefully skipping shelter if we're able to do so. Now, we had some one-time state ESG COVID funding in the amount of, $1.2 million. And this funding was spent on emergency shelter and rapid rehousing. And these emergency shelter expenses were used to help cover the supportive services costs in the hotels and duplexes that the county had been renting during the COVID pandemic. And all of the COVID funding, this 1.2 million is spent out, and the 2.2 million that came to the city is spent out at this point in time. So there is no more COVID funding unless the federal government decides to make these permanent increases. If we're looking at our dedicated housing funds, we do have money that comes in. We spend $200,000 in rapid rehousing. As an entitlement, our ESG funds that come to the city require a one-to-one match. The city does better than the one-to-one match by putting $200,000 into it so that we can do rapid rehousing. We also have $215,000, which is the city's portion of the unsheltered coordinating agency. And we have a $477,000 contract annually for coordinated entry with diversion, which is our entry point for everyone who's experiencing homelessness, goes through this system and is staffed 7 days a week, 365 days a year. There are some funds to help with diversion costs, and there are other funds to assist with that. The HMIS is the portion of the HMIS system that is not funded by HUD, but is required so that we don't have to charge HMIS users, the nonprofits, a licensing fee and fees. The city has agreed to pay the full cost that HUD does not cover for the HMIS system. We also have increased our homeless team staff. As you may be aware, homelessness doesn't seem to be going away anytime soon. And we had a staff of 4. 4.5, we will be a staff of 7. There were 2 new positions that were added to our team in the last budget cycle. So we will be increasing and we're in the process of filling our last 2 positions. Now we've got, after the COVID money ended, as you'll recall that ended, there was still a need for various services to continue. So the city and the county partnered. The county is paying for motel rooms in a duplex, and the city is paying for a landlord engagement contract to try and increase landlords willing to work with people exiting homelessness. We're standing up a white flag shelter, a non-congregate white flag shelter again for this cold weather season. That'll help approximately 20 to 23 households on a given night. And we maintain our increased rapid rehousing capacity and ensure people who were in rapid rehousing weren't exited to homelessness. We put more money into that. And we added $629,000 for emergency shelter supportive services. So this is to pay for case managers, food, security, laundry, all the supportive services that are required in an emergency shelter, where the county is paying for the rooms. We're covering the supportive services piece. If you want to look at what we've done in the last 2 years, and this is because this includes the COVID funding, which is one-time funding. So if we run this next year when all the COVID numbers are out, this, was it $6 million-ish, is going to be a whole lot smaller. But here's what we were able to do with the amounts of money that came through the system in the last 2 years. We helped 141 households in street outreach, 1,100 through different emergency shelter programs, 253 households in rapid rehousing, 318 households in permanent supportive housing. The permanent supportive housing, I will say, also includes some of our veterans money, which gets counted in there, and the city does not control that. That's a HUD to the VA. However, the VASH program gets counted in our statistics. So that 1.8 is going to be a little bit low because there's money that we don't know the dollar amounts on that contribute to help those 318 households that include some number of veterans. We also had a one-time homeless prevention project that we stood up using our ESG COVID funds, and that was able to help 238 households avoid homelessness due to preventing them from losing housing. And keep in mind, homelessness prevention is not the same as eviction prevention. The two are very, very different. Homeless prevention is really targeted to those who are most likely to become homeless without this funding. Not all evictions end up in homelessness. All evictions end up with people losing their housing, but not all evictions end up with every household entering the homeless system. That's what I've got. Questions?
Anyone have questions?
Colin, I have a couple questions. This is Rita McDaniel again.
Mhm.
In the ESG funds, was HOPWA included in that $2+ million?
HOPWA was not included in that. HOPWA had $74,000-ish in HOPWA COVID funds.
Okay, so my next question is, how is the ESG funding determined for emergency shelter? Because I noticed there was a lot of the amounts changed. So how is it determined from year to year? Is it like this year we had 74 homeless people, next year we have 125 homeless families? Is it determined that way, or is it another way that it's determined on the amount that's given?
That's given to the emergency shelters? Well, a lot of it is based on HUD priorities, because this is the bulk of the money is HUD's money, and they prioritize, a minimum amount going towards rapid rehousing, which is permanent housing placements. So we have to put 40%. Then the balance of that 60% from the state is able to be applied however people apply for it. And it comes into strength of applications, and a scoring committee makes recommendations. So the emergency shelter funds that are with our annual allocations from ESG funds that are part of the entitlement are currently part of a 3-year contract that will end December 31st, 2023. So sometime next spring or summer, we'll go through another RFP process to put funding into play for the next cycle of emergency shelter rapid rehousing funds.
I have one more question.
Mhm.
From the COVID ESG money, were there any people, or if y'all have data supporting this, that went into temporary housing that could then did any of them go into rapid housing? Do y'all keep track of that?
Help me understand what you're asking. Are people who went to temporary housing and then it became permanent?
Yes, with the COVID ESG monies.
I'm trying to think that would be part of a system-wide recidivism report that we probably wouldn't have that data for a year or two, which is where we would find out how many people in the last year, 2 years returned to homelessness. We may not be able to tag it back to specifically what happened with those COVID funds. And we could go run reports for the COVID rapid rehousing exits to see how many people exited to permanent housing. But in order to figure out if they remained in permanent housing, we'd have to do that at a system level.
Thank you.
Mm-hmm.
My name is Kamaria Faison, and I did work in domestic violence shelter locally for a little under 5 years before I decided to resign. I am concerned about, of course, the use of how the funding that was utilized at the shelter during my time there. I was probably one of the only bilingual staff there. And my question is that funding that was used during that time holding those rooms open? Was it used just to have those rooms on reserve, or only for folks who were occupying those rooms? Because from what I understand, even if there were vacancies, they were not being utilized adequately. And so I am curious about what those numbers look like in comparison in terms of availability versus spots that were actually filled.
Are you talking about at the domestic violence shelter or the emergency shelters in general?
Emergency shelters in general. That was just my one experience. And I saw that things were kind of vacant, let's say that, inappropriately so. And so I am curious to know how agencies are being held accountable for making sure that those spaces are filled, regardless, even if it's just for somebody who is seeking shelter, because if it's paid for already, who are you to say how this, as long as it's helping keep somebody off the street, it needs to happen, and these funds don't need to go to waste. And I do have some concern for who the gatekeepers, if you will.
Sure. So I think that's a great question. There's a couple different contracts that are all in play here, where there was a portion of rooms that were only paid for if they were being occupied, that the county paid for only if they were occupied. Obviously, your supportive services costs don't change drastically if you've got a couple empty rooms. You're still, if you're feeding 40 people versus feeding 38, there's not a huge price difference. And your staffing isn't going to change radically for 35 or 40 rooms. You're still going to have the same staffing costs. The system is in place that when there is an emergency shelter vacancy, a report is sent to coordinated entry saying we've got an empty room. Coordinated entry then reaches out to the people who are at the top of the list and coordinates an intake time. There are times where people will show up for an intake and are given a room and then don't return. There are times where people are scheduled to show up for an intake and don't show up for an intake. So there's a lot of reasons that rooms remain empty. There have been other times where rooms are sometimes damaged by the previous person who's in there, and they may need to be taken offline until repairs are made to make it usable again. We do the best we can to stay on top of that, but without, somebody on site 24/7, you have to trust your vendors are submitting vacancy reports when there are vacancies. And when reports, when somebody calls me and says, hey, we think there's an empty room in blah, 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 blah shelter, then I'll reach out and say, hey, I'm hearing there might be some empty rooms if you send a vacancy report. And they'll say, oh yeah, we sent one, and coordinated entry may say, oh, we never got it. We have had some problems with our system of transferring information at various times, but we work to get that fixed as quickly as possible because, technology breaks sometimes. Does that answer your question?
It does. I just hope going forward that there is a bit more of an open conversation around that, so that people feel open, free to actually communicate that with you or with other folks. That's all.
Sure.
That's good. That's good.
If there's any things that come up like that, please reach out to me and my team anytime, and we're happy to look into those, because we don't like sitting on empty rooms that are paid for when there's lots of people who run shelter and need this space. So that's something that when those come when those get flagged to us, we jump on those immediately to make sure we get those filled as quickly as possible.
I only wish I had is that I've been more in touch with folks like yourself, and I would have brought it to your attention. Absolutely, because I have no problem with blowing any whistles. So,
Very good.
but anyway, take care. Thank you.
Yeah, I will say the one place that we really have very little visibility is into the domestic violence or intimate partner world, because that database is separate from the database that we use by statutory regulation by the federal government. So we have no way of being able to like look in that project and say, hey, you're supposed to have 15 beds, but it looks like only 10 of them are occupied. So that is a blind spot that we have as a system, and it's there due to federal regulations.
Thank you.
So there's a question in the chat. What do you see as the long-term impacts of COVID on the Durham Homeless Services system? How might we respond to those challenges without the additional COVID money coming through?
That is a great question. The long-term impacts of COVID is one, we've learned that packing people into a congregate shelter often creates a lot of conflict, and people are exited prematurely from overcrowded congregate shelters. So I suspect when we close down the non-congregate shelters, the congregate shelter will probably, Urban Ministries has indicated they're probably not going to go back to 100% occupancies, just to be able to focus on getting people into permanent housing and try and reduce the amount of conflict and discharges due to negative behavior. So what does that mean for people who are unsheltered? It means fewer shelter beds. However, if the shelters do a better job of working with people with less conflict and can actually work with people to get them into permanent housing, we may turn the beds over faster. So we may end up increasing our capacity. I mean, if you've got 100 beds and you can turn those 100 beds over, 4 times a year, instead of 2 times a year, you've, doubled your capacity of serving people, moving them through the system a little faster. I think it's going to take some creativity of what do we do without the funds. And it's going to be one of those things that, as we look at, one of the reasons we brought the landlord engagement contract back in is to try and incentivize and work with landlords. That's one of our biggest challenges that we have for figuring out how do we move people into permanent housing when we've got a hot real estate market where rents are going up above what HUD allows us to pay. And how do we incentivize landlords to take people with less than stellar credit and less than stellar jobs and may not be making 3 times the rent amount into their units. So I think that'll help us as well. A lot of it is going to come down to creativity of how do we work this through, and do we need to look at reallocating money? Do we need to find additional sources of funds? And I don't have all of the answers to that, but that's something that we're working through, and policy and planning and the Homeless Services Advisory Committee is trying to think through what are the next steps.
So we'll take 2 more questions. Becky has one in the chat. What trends do you see in services for justice-involved people?
That's a good question. Justice involved.
Good question.
So I've been part of a few early discussions, and we're trying to bring the Venn diagram a little bit more into focus, because we've got people who are justice involved, and we've got people who are experiencing homelessness, and we have people who have health or substance abuse issues, and we have people with physical health issues. And sometimes all of these things intersect, which creates your, perfect storm for the hardest to serve person or household. So I think a lot of this is going to be over the next, year or so, as we try and narrow that Venn diagram down and try and pinpoint some case studies or some pilot groups of here are some people we can identify that intersect the justice system and the homeless system, because not everybody in the justice system is homeless, just like everybody who's experiencing homelessness doesn't have justice involvement. We do know that the two, where those two groups intersect, have a much more difficult time accessing housing. So it is something that is being looked at, and something I know the mayor has made a priority as well. So I'd say more to come on that as we, work on doing some research about that.
Rosa, did you want to ask a question?
I'm going to hold up for Maggie, the question in
Okay.
there.
Maggie has asked, could you share more about the White Flag shelters operating? How do folks access those beds? Is that through coordinated entry as well?
Yes, coordinated entry is your best place for that, and it will be prioritized for medically vulnerable. And there are some number of units that'll be set aside for families that'll be prioritized. There's just not enough money to help everybody on White Flag nights. So unfortunately, right now there's by self-report, there are 38 unsheltered families waiting for shelter and 88 single adults waiting for shelter as of today. So if White Flag were to be called, maybe 20 to 24 single adults and maybe 6 to 8 families out of that group would have a space, would be prioritized, and that's just a funding issue.
Would you repeat those numbers that you say are waiting? The unsheltered?
The count is, and this is, keep in mind, this is by self-report, so we don't have third-party verification. And, so right now by self-report, there are 38 families that are unsheltered and 88 single adults that are unsheltered waiting for shelter. So we're anticipating, to have about 20 rooms available, and some of those rooms will be double occupancy, but we will carve out some of those 20 rooms specifically for families and probably prioritize families with children under the age of 5 will probably be a higher priority than teenage kids. Not that we want any kids being out in the cold, but kids under the age of 5 are a little bit more vulnerable than the 15-year-old. And I hate to say it, but unfortunately it's, the proverbial dialysis machine, and kidney probably got 1 kidney and 100 people who need it. How do you decide who gets it?
And our last question can come from Rosa.
Okay, I wanted to, you heard Drew share what they were doing with Open Table. Is there anything that you could share with him that we could start a collaboration with Open Table? Because we seem to be in line with some of the service that you need. Did we miss something when we didn't connect with you in terms of grants and that kind of stuff?
Drew's organization has $200,000 from the city that's
Okay.
We're paying Drew to do the work.
Okay, all right, that's good to know. Thank you, Colin. I appreciate that.
You got it. And as a side note, the Policy and Planning Committee, which is a subcommittee of the Homeless Services Advisory Committee, met today, and they're racking their brains and have expanded their White Flag group, are going to spend about a half an hour at the December meeting trying to figure out what can we do to increase that capacity.
Good.
Obviously, money is going to be a big piece of it. Capacity, because you got to find staffing, either volunteers or paid staff, and you got to find a location. And you got to find a place that with 48 hours notice, you can say, hey, go to this location. So that's going to be something that is going to be worked on. Whether or not we'll be able to get anything stood up, to expand what's currently in place for this year, it may be a pretty big lift. The hope would be that if we can't expand what's in place for this year, that we might be able to start, having a more robust, all right, this is how we'd like to do it next year, and this is what it would cost, and start thinking it out.
There was a question.
I will say on the White Flag piece, it's important to remember pre-pandemic, the only White Flag beds that were available were when urban ministries would sort of allow 10 or 15 overflow folks.
Mhm.
So because of this pandemic, we've really expanded stuff. And at some point, unless we can find
gonna
ways
bring
to
it.
sustain, hundreds of thousands of dollars a year for a very short cold weather season, it would, by default need to go back to pre-pandemic levels.
Oh, no.
If it's one of those things, if we go to pre-pandemic levels, it is what it is. If we want
It
to
is.
expand, if we want to keep it if we want to keep what we currently have, or if we want to double, triple it, then we have to have the money from it, which has to come from somewhere, and it all comes from the same pot.
Right.
So it's,
Yeah.
all right, do we pull it from affordable housing? Do we pull it from subsidies? Do we pull it from permanent supportive housing? What gets cannibalized to fund the other, it's sort of figuring
Yeah.
out the priorities with the same pot of money.
It's well said. Well said.
I don't know if Lloyd is still on here or if you have the answer to this, but do we know when our point in time count is in January and all the arrangements of what we're doing for it yet?
It is the last Thursday, January 25th, if I remember correctly,
Why y'all gonna do it on my birthday?
because that's when HUD tells us to do it.
Okay. Okay.
Or January, hold on a second. Yeah, I believe it's January 25th.
Okay.
So we are partnering with Housing for New Hope, which is our unsheltered coordinating agency. So we are going to do some volunteer outreach as well as the plan. So we'll be recruiting volunteers and start doing that outreach in the December timeframe and doing trainings and doing that. So we'll be ready to rock and roll in January.
Okay.
Colin, sorry,
ma'am.
raise my hand this way.
Go ahead, Nicole.
I just want you to keep me in mind. I will share my information with you. I have a class that's focusing on urban issues and problems in the spring, and this will be one of their assignments
Perfect.
to volunteer with you all.
All right.
Very good. Awesome.
I will
All right,
pass it
well-
on to Housing for New Hope and to Lloyd.
Well, thank you, Colin, for coming today. We really appreciate it. This was great information. And thank you for answering questions and having a very spirited discussion. And I will
Absolutely.
pass to Rosa.
Anytime.
Okay. You guys are awesome. We're on time. Nicole, can you come and share end of the year survey and plans for this December meetings?
All right, the exciting parts of the year, our end of the year survey. First, I'd like to say, thank you all. This was a very informative presentation. So thank you, Colin and Drew, for the information that you shared with us today. I want you all to start thinking about your assessment of how well or where there's areas of improvement for the coalition. Of course, my dog decides to start drinking water as soon as it's my time to speak. So I apologize if y'all hear that in the background. Sometimes he can be a little interesting. But I want you all to start thinking about what things we did well this year and where there's areas of improvement and where we should focus our efforts in 2023. The plan is right now we are finalizing the survey and we're having the option of it being delivered both virtually and through a Word document. So we're going to use NCCU's platform of Qualtrics survey instrument to try to make it a little bit easier. I'm not sure of all the challenges that have happened in the past, but I am taking Marcia's lead to try to see this through for this year. So the idea is that we're going to do a pilot study. Sorry, I'm an academic, so we always do pilot studies first. So send out the pilot study to the coordinating committee to get feedback on making sure that the survey is capturing the information that we want it to capture. But the plan is to send it out to members or affiliates of the coalition December 1st. Keep that window open for 10 days. So I won't say harassing you, but I will be strongly encouraging feedback because this is how we improve the programs and make sure that we are strong in our advocacy and initiatives. But the idea is to get feedback from you all December 10th, and then we'll report that information in our December meeting that will be in person. and have some more conversations on how we can best approach 2023. I didn't really need 5 minutes. We have any questions?
I wanted to make a suggestion.
Mm-hmm.
While I have you here before, Drew, you know, I've been pleading and begging, and I hope you will consider an internship opportunity with Open Table. I kind of put it out there at the beginning of the semester, not to you. I've overlooked you. I'm so sorry. But I did put it out there to one of your colleagues, and we were trying to do some work. But if you would, please connect with Drew and let us share what we were trying to do. So we really wanted NCCU full administration graduate student to participate in a project he was working on, which was doing we were updating the handbook. And I thought the resources that we had in public administration would be helpful. So if you could keep him close, and you know, I know how to walk down to your office. So we would like to talk to you more about how we can do that with your students and your colleagues. Okay.
Okay.
All right. Thank you. Now to keep us moving on time, we're going to do an update. Perfect timing, rental stability grant proposal. So who's doing the update? I don't know it, Becky. Do you know the update? Or
I'm
Nicole?
doing it.
Here's Jim. Sorry, did I
Okay,
leave that
Jim.
off?
Okay. All right.
Yes. We are distributing this. We have informed the council members and commissioners about this proposal. And what we want to do is to help make sure that people who are extremely low income but have housing already can stay in their housing, so they won't be contributing to those who either are homeless on the one hand or face eviction on the other. Neither the council or commission has given it much attention so far. We have an indication it probably will be late December before they make a decision about how the remaining COVID funds will be allocated. And so we need to be communicating with them, and that'll be a major stress for the next month. Oops, Rosa, you turned off your sound.
I'm sorry. I'm saying great. Are there any questions for Jim before we move on? Okay, Becky, events and meeting, you want to say anything there? That's not on the agenda, but you seem to have that under control much better than me. And future coalition topics. Are you still with me, Becky?
Yeah, yes, I'm here. And
Okay.
and I would like to, can you hear, did I
You are, you good.
we want to encourage everybody to come in person, and we might do a streaming thing too. But we want to have some good old fashioned in the room handshaking, maybe a hug or two, and some nice holiday treats while we talk person to person without technology about our survey results and what we should do next year. So that's our December program. In January, we are planning to, we often get told that, no, you can't do that. The state doesn't allow you to do that. And in January, we are going to try to get into what state policies we need to advocate for. And we have had, we want to invite our state legislators and have a brainstorming session maybe. I don't think we'll be ready to have any fixed positions by that time, but just talk about what might be possible and what they see that they think can be done and should be done. So that's going to be a very important and interesting meeting, I think, and I hope everybody will come to that in January. And that's all I have to say. I can have to say. Jim, are you?
Yes, just a reminder of the other upcoming meetings. The policy committee meeting will be Tuesday, the 29th of November at 5 o'clock, a virtual meeting. The coordinating committee will be meeting on the 5th of December. And Becky talked about the December meeting. That's the 19th. We're back to the third Monday in December. And we do hope that we can have a lot of people come together to have personal exchange as we talk about what we've done and our goals for next year.
Jim, you want to talk about the future coalition topics did you say that already for the 19th and 17th? Just summarize it.
I'm
I
sorry.
just,
So-
go
On
ahead.
the 19th of December, you say the future coalition topics will be planning for 2023 and the holiday party. I didn't know if you want to add
That's-
anything else to that.
Yeah, that's the 19th. And again, we'll also be looking at the survey results and then talking about goals for next year.
Okay. All right, guys, we have 2 minutes left. I wanted to thank everyone for taking time to join us, and I want us to stay close. You're working with two very important things. You can tell the heart of the people by the way we treat the most vulnerable in our community. So let's stay focused on that. Let's do our part. You're connected to some great people. Colin, I love you dearly. I love what you're doing. You couldn't do that if it didn't come from the heart. No degree, no training, put that in you. And you know, I'm going to toot my horn about Drew. I've seen him move and shake out there. Nicole is on campus. I'm just so pleased to have her with the Public Administrative Department, what she's doing. These are resources, and Jim and Becky, we stay connected. Let's do this, y'all. Let's lie down at night knowing we laid it all down. That's the way I roll when I walk out into the community. I don't want them throwing stones because I had no compassion. And I feel it here. Again, I want to thank you guys so much for the time. I love you all. Have a blessed week. And we look forward to you staying in touch with us. Jim, is there something I missed?
President, one more point. We will send out another copy of the flyer related to the low-income homeowners tax relief program. We've made a couple clarifications in it, but we need to spread the word because early January will be the deadline for that program, and the year is moving along. So we need to help spread the word. There's more assistance available now to the extremely low income group. They can have up to 60% of their tax bill covered by the grant and up to a limit of $1,500. So there's more help available. And also this year, it's only a 5-year residency requirement. So people who could not consider it last year with the 10-year requirement now can. So we will be sending that out to everybody on the mailing list, and please help spread the word.
Thank you. Much love, guys. Have a blessed day. Bye.
Bye.
Bye.